The alarming truth about blood pressure. What you need to know about the new guidelines. High blood pressure is a silent killer, and the statistics are staggering. Despite being a preventable condition, nearly half of all adults in the United States have higher than normal blood pressure, making heart disease the leading cause of death worldwide. But here's the good news. The American Heart Association and the American College of Cardiology have just released new guidelines to help minimize hypertension. And it all starts with making two simple changes to your lifestyle. The new guidelines, which are the first update since 2017, recommend that Americans limit their alcohol intake and reduce their sodium consumption. While it's no secret that excessive drinking can lead to a host of health problems, the impact of alcohol on blood pressure is often overlooked. The truth is, systolic and diastolic blood pressure both increase over time with alcohol intake, making it a major risk factor for hypertension. In fact, studies have shown that those who avoid drinking alcohol altogether have the lowest risk of hypertension, while those who reduce their intake by at least 50% can experience healthy blood pressure levels. So, how much is too much? According to the guidelines, men should limit their alcohol intake to no more than 2 drinks per day, while women should limit their intake to no more than 1 per day. But here's where it gets controversial. Some experts argue that even moderate drinking can have negative effects on blood pressure, and that the only safe amount of alcohol is none at all. What do you think? Should we be aiming for complete abstinence, or is moderation the key? In addition to cutting back on booze, the guidelines also emphasize the importance of reducing sodium intake. It's recommended that individuals limit their sodium consumption to 2,300 milligrams per day, with an ideal target of 1,500 milligrams per day. But here's the thing. Most adults get their sodium intake from eating packaged and restaurant foods, rather than adding salt to the food they prepare. So, what can you do? Start by examining the sodium content in the food you eat, and try using potassium-enriched salt substitutes when possible. But reducing sodium and alcohol intake is just the beginning. The guidelines also recommend adopting a heart-healthy diet, such as the DASH eating plan, which prioritizes meals high in vegetables, fruits, whole grains, legumes, nuts, seeds, and low-fat or non-fat dairy products. And don't forget about exercise. Experts urge at least 75 to 150 minutes of physical activity every week, from cardio to weight training. So, what's the takeaway? The new guidelines are a wake-up call for all of us to take control of our blood pressure and reduce our risk of heart disease. By making simple changes to our lifestyle, we can live healthier, happier lives. But it's not just about individual responsibility. It's also about creating a society that supports healthy living. What do you think is the most important factor in maintaining healthy blood pressure? Share your thoughts in the comments below. And finally, let's talk about the elephant in the room. Is heart disease still the leading cause of death? Unfortunately, the answer is yes. Despite the many advances in medical technology and treatment, heart disease remains the #1 killer worldwide. But here's the thing. It doesn't have to be that way. By working together to create a healthier, more supportive society, we can reduce the toll of heart disease and live longer, healthier lives. So what are you waiting for? Let's get started today.